My name is Dr. Viola Nyakato. I'm a senior lecturer in the Faculty of International Studies, Department of Human Development and Relational Sciences. I'm here to talk about a program that we are having in the community of Rwebisheke, Rwanyamahembe, Kashani on parent-child communication. This is an initiative that we started way back in 2014, I may say. Project initiative on improving the health outcomes of adolescents. And we started with a project that was conducting sexual and reproductive health education or sexuality education in school. And we work with partners from Belgium, Ghent University in Belgium, and Free University of Brussels, and ourselves at MAST. And first worked with Uganda Matters University and then Makerere University. And during the first study which we conducted between 2014 and 2019, there was a realization, or the findings indicated that children who communicate with their parents about growing up, about their reproduction, about their menstruation, about their friends, girlfriends, boyfriends, about their body changes, they had better reproductive health outcomes. They had less risks when it comes to being sexually harassed, and they would delay, they were not among the category, I'm talking about the 10 to 14 years, they were not among the category of young people that would initiate sex early. So we found out that talking to parents is protective. So that's when we came up with a proposal to further investigate what it means to talk to parents. As we all know, sexuality education, sex talk, talking about growing up is not our culture. It's not for parents. For most cultures, talking about growing up, it was a delegated role of aunties and uncles. So directed talking to parents is not a cultural thing in our communities. So what we did, we said, how can we improve? So because there was no example, we had to start to propose a research where we initiate and develop a talking initiative on growing up on different subjects. What is important for this project that is beneficial? As the children were at home, for us it was almost like a practicum. So as the parents learned about parent-child communication, they were home with their children, with the real-time experiences of growing up. And when the body change, because we are talking about the 10 to 14-year-olds, there is a drastic body change. And so the parents gave us a lot of sharing when they went out and they were talking to their children about growing up, about the body changes. So that gave them a real-time experience of experiencing the intervention and also practicing communication. So that's the benefit, that the children were at home and the parents were being trained on parent-child communication with sexuality and growing up. So it was really interesting. We don't say that we should have had this lockdown, but the benefit comes back to the community and also to the intervention. It would have been a disadvantage, but to the intervention. The parents were able to experience real time what it means to break the silence, to start talking about things they have not talked about their children. We saw testimony. Parents came every day. Every time we called a meeting, a crowd came. So they were coming to experience, they had the experience at home and the experience at the training. So that's the benefit that we had. And no wonder the community feels they were protected. Their children were protected from engaging in sexual acts, from pregnancy. So we maybe would have had more and more cases, but this community is experiencing less challenges when it comes to sexuality, when it comes to growing up, when it comes to reproductive challenges. So that's the benefit.